We've all been there. You look in the mirror and see it, a big, juicy pimple staring back at you. The urge to squeeze is almost unbearable. But why? There's a scientific reason for this satisfaction. Popping a pimple releases endorphins, our body's natural feel-good chemicals. This release triggers a sense of relief and pleasure, making us feel like we've accomplished something. Moreover, pimples can be annoying and embarrassing. They often appear in the most inconvenient places, like right before a big date or an important meeting. Popping them feels like taking control of the situation, restoring our confidence. However, as tempting as it may be, it's crucial to remember that popping pimples can have negative consequences. Understanding the risks and benefits is vital for maintaining healthy skin. Before we delve into the do's and don'ts of pimple popping, let's understand how these pesky blemishes form. Our skin has tiny holes called pores, which contain oil glands. These glands produce sebum, an oily substance that keeps our skin moisturized. Sometimes, dead skin cells, dirt, and excess oil can clog these pores, creating a perfect breeding ground for bacteria. This bacterial growth leads to inflammation, resulting in the red, swollen bumps we know as pimples. The type of pimple that forms depends on the severity of the clog and the type of bacteria involved. Understanding these differences is crucial for choosing the right course of action. Not all pimples are created equal. Some are harmless and disappear on their own, while others require special attention. Here's a breakdown of common pimple types. Whiteheads. These small white bumps form when a pore is completely blocked with sebum and dead skin cells. Blackheads. These appear as small, dark spots on the skin. They are open comedones, meaning the pore is open at the surface and the trapped sebum oxidizes, turning dark. Papules. These are small, red, and inflamed bumps that are tender to the touch. Pustules. These are similar to papulas, but have a white or yellow pus-filled center. Nodules. These are large, hard, and painful bumps that develop deep within the skin. Cysts. These are the most severe type of pimples. They are large, pus-filled lumps that can be painful and leave scars. Knowing the difference between these blemishes can help you determine whether home treatment is appropriate or if you need to see a dermatologist. Whiteheads and blackheads are the most tempting to pop, but should you? Whiteheads are generally safe to pop at home, but only if they are ready. A ready-to-pop whitehead will have a visible whitehead and be close to the surface. Blackheads, however, are best left to the professionals. Their deep-seated nature makes them difficult to extract without causing damage. Squeezing them often pushes the debris further into the skin, leading to more inflammation and potential scarring. Section 5: Danger Zones and DIY Disasters. The risks of improper popping. While popping a pimple might seem harmless, doing it incorrectly can have serious consequences. Scarring. Aggressive squeezing can damage the surrounding tissue, increasing the likelihood of permanent scarring. Infection. Introducing bacteria from your hands or tools can lead to infection, making the pimple worse. Pain and inflammation. Squeezing can push the pus and bacteria deeper into the skin, causing more pain, swelling, and redness. Spread of bacteria. Popping can spread bacteria to other areas of your face, leading to more breakouts. It's crucial to remember that the skin on your face, especially the triangle of death area between your nose and the corners of your mouth, has a unique blood supply that can transport infections to your brain. Avoid popping pimples in this area altogether. Section 6: Pimple Popping Myths Busted. There are many myths surrounding pimple popping. Let's debunk some common ones. Myth: toothpaste can dry out pimples. Fact: while toothpaste contains ingredients that can dry the skin, they can also irritate and worsen the pimple. Myth: popping pimples makes them go away faster. Fact: popping can actually delay healing and increase the risk of scarring. Myth: only teenagers get pimples. Fact: hormonal changes, stress, and certain medications can cause acne in adults. Relying on myths and misinformation can harm your skin. Always consult with a dermatologist for accurate information and advice. Section 7: When popping feels good, the science of satisfaction. Despite the risks, pimple popping can be incredibly satisfying. Why? It all comes down to neurochemicals and psychology, endorphin release. The act of squeezing triggers the release of endorphins, our body's natural pain relievers and mood boosters. This creates a feeling of pleasure and relief, even if it's temporary. Sense of control. Pimples can be unsightly and embarrassing. Popping them provides a sense of control over our appearance, boosting our self-esteem. Visual gratification. There's something oddly satisfying about seeing the pus and debris come out of a pimple. It's like a visual representation of the problem being eliminated. However, it's important to remember that this satisfaction is often fleeting, and the potential consequences of improper popping far outweigh the temporary pleasure. Section 8. The right way to pop a dermatologist's guide. If you absolutely must pop a pimple at home, here's how to do it safely. First, wash your hands and face. Thoroughly cleanse your hands and face with warm water and antibacterial soap. Next, apply a warm compress. Soak a clean washcloth in warm water, wring out the excess, and hold it against the pimple for 5 to 10 minutes. This softens the skin and brings the pus closer to the surface. Then, use sterile tools. Never use your fingernails. Instead, wrap your index fingers with clean tissues or use sterile tools like a comedone extractor. Now, apply gentle pressure. Apply gentle, even pressure around the pimple, not directly on it. If the pus doesn't come out easily, stop squeezing. Finally, cleanse and treat. After popping, cleanse the area with antibacterial soap and apply an over-the-counter spot treatment containing benzoyl peroxide or salicylic acid. Remember, these steps are for whiteheads only. Never attempt to pop blackheads, pustules, nodules, or cysts at home. Section 9. Skincare strategies, winning the battle against blemishes. Preventing pimples in the first place is the best way to avoid the temptation of popping. Here are some skincare tips. Cleanse twice daily. Wash your face with a gentle cleanser morning and night to remove dirt, oil, and makeup. Exfoliate regularly. Use a gentle exfoliating scrub 1 to 2 times a week to remove dead skin cells and prevent clogged pores. Choose non-comedogenic products. Look for skincare and makeup labeled as non-comedogenic, meaning they won't clog pores. Hydrate your skin. Use a lightweight, oil-free moisturizer to keep your skin hydrated without clogging pores. Avoid touching your face. Touching your face with dirty hands can transfer bacteria and lead to breakouts. Remember, consistency is key when it comes to skincare. Stick to a routine and be patient with the results. Section 10. When to seek professional help, don't let it get out of hand. While most pimples are harmless and can be managed with over-the-counter treatments, some situations require professional help. Severe acne. If you have severe or persistent acne that doesn't respond to home remedies, see a dermatologist. Deep or painful pimples. Nodules, cysts, and pimples that are extremely painful or deep require professional treatment. Signs of infection. If a pimple becomes increasingly red, swollen, painful, or starts to drain pus, seek medical attention. Scarring. If you're concerned about acne scars, a dermatologist can recommend treatments like chemical peels, microdermabrasion, or laser therapy. Remember, early intervention is key to preventing complications and achieving clear, healthy skin. Section 11. The final verdict, to pop or not to pop. Popping pimples can be tempting, but it's generally best to leave it to the professionals. While the satisfaction might be real, the risks of scarring, infection, and worsening your acne are significant. Focus on maintaining a consistent skincare routine, treating pimples with over-the-counter remedies, and seeking professional help when needed. Remember, healthy skin is the most beautiful skin.